Bulvinaka, and welcome to Health Talk with Oceania Hospitals, where we bring you expert insights on health and wellness. I'm Alex Tavilati, your host, and today, in celebration of International Women's Day 2025, we're diving into women's health and empowerment. Joining me is a true leader in this field, Dr. Pushpa Nusair, a senior consultant and obstetrics and gynecology, with over 3 decades of experience in women's healthcare. Dr. Nusair, welcome to the show. Thank you very much for accepting our invitation. How are you?
Thank you, Alex. It's a pleasure to be here.
Thank you. This year's International Women's Day is all about accelerating action. From your perspective, Doctor, why is women's health such a critical part of women's empowerment?
Alex, women's health is the foundation of empowerment. When women have access to quality health care, they can make informed choices about their bodies, about careers, about families. We have seen progress in this field, but there is still a lot of work to be done in areas like sexual and reproductive health and rights, maternal health, and menopause awareness.
That's really interesting. Speaking of progress, in your 30 years of experience, what are some of the biggest positive changes you've seen in women's healthcare?
One of the biggest changes is increased awareness and education around women's health. Nowadays, what we notice is that more women are seeking regular checkups, and topics like contraception, pregnancy, and menopause, which were once very taboo, are now openly discussed. And technology also has advanced, which allows for better screening and treatment and care.
Thank you. Despite these advancements, what are some of the biggest challenges still facing women's health, especially here in Fiji and the Pacific?
Well, one of our major challenges is healthcare access. Many women don't seek medical help due to distance and cultural beliefs or financial barriers. And issues like unplanned pregnancies, cervical cancer, obesity-related complications, they all remain a great concern.
That's so important to highlight. You've done research on these issues. How can we address them at both a policy and a community level?
It starts with education and awareness. I think we should start with schools, even in workplaces, and community leaders must normalize conversations about sexual and reproductive health rights. Policies should afford affordable screening and better maternal care. And as a society, we must empower our women to prioritize their health without any stigma.
And that's exactly why these conversations matter, Speaking of breaking barriers, menopause has been a growing topic globally. Why do you think it's important to discuss this issue openly?
Menopause affects every woman, yet many feel unprepared or even to talk about it. They are actually ashamed to talk about it. It's not just about hot flushes. It's about mental health, bone health, and overall well-being, and the risk of other diseases that may surface. Women need support from their families, from workplace, from doctors to navigate this phase with confidence.
Doctor, as a former president of the Pacific Reproductive Health and also an educator at Fiji National University, what advice do you have for young women pursuing careers in medicine?
Alex, I tell all my students, believe in yourself and never stop learning. It's right from the womb to the tomb. Women belong in a leadership role in healthcare, and we need more female doctors, researchers, and policymakers to shape the future of medicine in Fiji and Pacific.
That's inspiring. Lastly, If you could give one piece of health advice to all the women listening today, what would it be?
Since we are celebrating International Women's Day, can I say to all the women who are listening out there that please make your way to Oceania Hospital. In Oceania Hospital, you will be treated with utmost dignity and with exceptional care. All the problems you have will be treated with utmost confidentiality, and we have all the services available here to take a pregnant woman right from the time of conception to her delivery. We also have facilities available here if you have any gynae issues relating to sexual reproductive health and rights, or any other issues which are relating to you to menopause. You are most welcome to come to Oceania Hospital. We have other support services available as well. If you are obese and you want to lose weight, we have a dietitian, we have physiotherapists. So we all work as a multidisciplinary approach, which will really take your health on the right track. So please, I hope that this International Women's Day will make you prioritize your health and make your way to Oceania Hospital.
Wise words to end on, and it's also to end the week and to start International Women's Day. Thank you so much, Doctor, for sharing your knowledge and insights. A great honor to have you with us today, and thank you for accepting our invitation to come on to the show.
Thank you, Alex. Vinaka Vakalevu, and happy International Women's Day to everybody.
And that's it for this week's episode of Health Talk with Oceania Hospitals. If you found this discussion helpful, share it with women in your life. Stay informed, stay empowered, and we'll see you next time. Vinaka.
Vinaka.